everyone. Welcome to Food for Life this week. I'm so excited about our guest. You know, when I have my friends on, I tell you guys all the time, this is one of my nearest and dearest. She's one of my oldest friends, but she's an expert in her field, and we're going to talk some really fun things. I know talking about the dentist is scary. I know everyone is terrified of them, but Andrea is not terrifying, I promise. So Dr. Fallon will come on. We're going to talk about what kinds of foods affect our teeth, all the fun things. We're going to hear about how she became a dentist. Doesn't that sound fun, guys? I know. It's all right. We'll get there. So I know Memorial Day is coming up. Is everyone excited to get out, get into the pools, get some sunshine? Let's hope we have a good weekend. I have an event this week, so I'm hoping the sunshine comes out for it, especially since it's outside. So everyone pray for us. So after these messages, we will hear from Dr. Fallon. Let's thank the good people at E20. Hi, Dr. Fallon. Welcome to the show. Or as I call her, I just call her Andrea, but that's okay. What would you like to be called today?
Ashley, you can call me Andrea, whatever you're comfortable with. We've been friends since we were like 10 years old, so hey, you works for me.
That is very true. We've been friends since we were kids, so I've called her a lot of things over the years. She's called me a lot of things over the years. But tell everyone a little bit about yourself.
All right. Well, I'm a general dentist in New England. I graduated from the University of Connecticut almost 15 years ago now. I live in Western Massachusetts with my husband and my two children. I have my daughter, Evangeline, who is almost 11, and my son, Colin, who is almost 9. So life keeps me super busy, owning 2 practices and opening a third with my business partner, along with all the activities the kids have. I feel like I'm constantly running. So I enjoy a lot of stuff outside of dentistry as well. I enjoy crafting, and I'm a runner, I'm a biker. I just like to stay active.
You know, when you say the kids' ages, it makes me feel a little old too. I can't believe they're that old already.
Yep. And Ava, my daughter, is she's 5'2". She's probably almost as tall as your mom at this point.
Well, she's going to be taller than my mom soon. So we want to let everyone know, you know, dentistry isn't always the typical field everybody wants to go into, but I know you've wanted to be a dentist since we were young. So can you tell everybody why you wanted to be a dentist?
Yeah, you know, I think as a young child, I just wanted something. I very much love science. So science was my strong suit, and I felt like I needed something along those lines. Went to the orthodontist with my brother, who had a lot of orthodontic problems as a kid, and kind of watched the workflow with the orthodontist and was like, he looks like he's having fun. Like, I want to enjoy my job, right? Like they say, if you enjoy what you do.
With braces.
Right. So I actually wanted to become an orthodontist to start off with, and went through all of high school trying to do good so that I could get into a good college that would get me into a good dental school. And once I was in dental school and realized that teenagers weren't really my thing at the time. And so I ended up deciding to go into general dentistry. So I started off in the early 2000s as a general dentist that provided comprehensive care. So aesthetic, cosmetic, implants. And then about 5 years ago, I found my true passion, which is how our jaw joint and the functioning of our teeth and jaws actually work, and making people feel comfortable. You'd be surprised how much just everything with our joint can affect our whole body and the musculature of our body. And then how does that translate to someone who comes in that wants a beautiful movie star smile? So kind of starting at ground zero and moving forward. Yeah. And I work a lot with kids. Our second office is a lot of kids at this point. Being a parent now, have gotten over my heebie-jeebies of the teenagers. And so I do a lot of general dentistry for kids as well.
So you're talking about the jaw, which is so funny, is I slept wrong the other night and I had a pain in my neck and it literally went up and through my jaw. Like it was like super tight. And it's so weird that you say that because as our musculature and our skeleton, everything is connected. And it took me forever to get it out, like the nut.
Yeah. Yeah. And especially women, we find that women tend to end up with a lot of jaw pain. Men tend to break their teeth more and wear their teeth more, but women end up with a lot of pain. And we're not really sure why that is. The data shows that it might be hormonal, but we're not 100% sure, but there's definitely ways to get yourself comfortable. So if it's a recurring thing, you need to come to the office and see me.
No, I think that I've been tossing and turning at night, so I think I just ended up in a weird position. But if it does continue, I will definitely come and see you. But it was just so weird because I was trying to do my workout and my trainer's like, yeah, okay, let's stretch this out. And when I'm stretching, I can feel it all the way up the side of my head. It's crazy.
Everything's connected.
Theoretically, yes, it is. Everything is connected eventually. That's so weird that women have more issues. Do you think it's more stress and tension that we carry up here that causes all this?
I think so, but it's also related to our hormonal cycles. During certain times of your cycle, you'll actually be less able to cope with pain. Marathon runners and active people that compete at a high level will tell you that based on when they are in their cycle, it can actually affect their athletic performance. And we think it's because of the inability to push through pain because our tolerance is just low hormonally. They think it's something to do with the estrogen, but no one's really sure.
That's a new one on me, but I've known some people that run marathons. I've never heard that from them. That's a good one. I love that you're talking about the kids practice. It's actually really cool, their kids practice. You know, if I were a kid, the dentist would have been less scary if I went to a practice like that. It's so cool. They have stuff painted on the walls. They have a fish tank. I mean, what made you guys think to make it so kid friendly other than just, like when you go to the doctors and you get put in one of the pediatric rooms by accident and they only have a few things on the wall like stickers, but you're like the whole place is kid friendly everywhere.
Yeah, we used to see a lot of kids out of our general office and we did okay with them. We did the best we could, but they didn't really appreciate the aesthetic, and walking in, it looks like an adult place to be. It's not friendly for kids. From the second they walk in, the light fixtures, seeing in the entryway, it doesn't look kid friendly. The ones we have in our entryway look like big balloons and there's like 15 of them. And so instantly from walking in, it kind of diffuses their anxiety. We often have kids that skip in. So ultimately the reason we did it was we felt that we could do better with this population. And I think that a lot of dentists and providers feel this way if they see multiple age groups, is that there's always a population that you feel less comfortable with. And we figured that if we created an environment that was more suitable for these kids, that we would probably be able to get more dentistry done and happier results at the end, which has definitely proven to be the case. And so we started with a designer to kind of come in and say, what are you guys looking for? What are some of the design things that you need? Where do you need doors and things like that? And then it turned into, okay, well, this generation, they're very into, technology and all of that jazz. So we kind of used a computer as our theme. So our carpet actually has like big blocks of like color interspersed, and that's on purpose. We use it. Kids will jump from one green carpet to the pink carpet, and it helps them get to their operatory, and they're happy when they get there. So I think it was more of a brainchild, the whole concept of my business partner and I feel like, what can we do better for this population? what population in our current practice could we be doing better for? And we felt that the pediatrics was what needed help. And we don't want, the practice has been open for 5 years now, so we haven't seen this yet, but our kids are going to age out of this practice eventually. They're going to move into the adult practice. And we're hoping that by having them in an environment that they're happy with, that we will see less dental anxiety in these children when they become adults and move to the other office.
What's the age group in the kids practice? Because I know my niece goes there, and she started when she was like 3 or 4 to come in, or maybe younger. I'm not sure. How young do they have to be when they start coming in?
Oh, that's a great question. So the American Dental Association does recommend 1 by 1 is the program. And so 1 by 1 means first visit 1 by either first tooth or first birthday. So whichever comes first. And we know, we get it. A 1-year-old, a 9-month-old, my son got teeth at 6 months old. They're not sitting for a cleaning.
No.
We know that, but this is education for the parents. And ideally, if we can capture parents when mom's still pregnant and start educating them on diet, hygiene, things to look out for. There's even therapies we can do if the baby's not nursing well. We can work with lactation consultants to help them nurse better. So there's this whole slew of things that people don't traditionally think are the realm of the dentist. And that when you have children, you don't think that, putting my kid to bed after having a glass of milk isn't a problem. It's not sweet. It's not sugar. And then you go to their visit, the first visit at 4 years old, they have a lot of decay. That could have been mitigated. And we're seeing that over the past 5 years of having this program be in place. I think 5 to 7 years they've been talking about this. We have seen some areas of decay definitely decrease. And it helps us as providers make sure that we're seeing those kids as early as possible. Not to see the kids necessarily. We just want them to have fun in the office that first visit. But it's to talk to the parents that we can mitigate any cavity risk that is present given their, family life. So we do see kids anywhere from 6 months old up to about 21. We'll transition them over depending on their insurances. Although there is sometimes the rarity where we see infants. And this goes back to the nursing thing I was mentioning. Yesterday, I saw a 4-day-old. So, So sometimes we see infants as well. So there's a whole slew of different reasons to bring your kid to the dentist really young. And if you're unsure, you really should just talk with your provider and see when is appropriate.
Well, now that I have a new nephew that was born last week, I'll have to tell them about that.
Absolutely.
So I'll have to know. I didn't know that you could see babies just for that kind of thing. We'll talk about diet in a little bit, but the idea, we don't think things are harmful, and I always talk about getting kids to eat right when they're younger, but there's habits in place, not just what we eat, but how do we keep healthy? And part of that is, how do we take care of our teeth?
Yeah, that's a great question too. The American Dental Association and all your state associations will recommend brush twice a day for 2 minutes each time, and then floss once a day. Some of the recommendations for fluoride are really important as well, depending on if you have fluoride in your water for your kids or not. But all adults should be using topical fluoride in their toothpaste. The systemic uptake or your whole body uptake of that is so minimal, but it definitely helps produce a stronger tooth enamel to prevent decay even as adults. So that's the recommendation. What was that? I'm sorry.
In all toothpaste, or do you
it's
have
not in all? Specifically? No, yeah, you have to look and make sure. Like 90% of them have fluoride, but there's definitely a movement against having fluoride in some. So there are versions available with no fluoride, but I discourage against that because you're not swallowing it, you're spitting it out, staying on your teeth and helping them stay nice and strong.
So I know fluoride's important, and people talk about calcium as well. Now, that's obviously not something we get in our toothpaste, unless there's a toothpaste I don't know about when I was standing in the aisle at Target the other day. But you see so many different things now in toothpaste. And one of the things that I can't understand is there's charcoal in toothpaste now. Like, What is that supposed to do? Is that something that's useful for us, or is this just one of those really weird trends? Because I don't want to brush my teeth with black toothpaste. I really don't.
No, it looks kind of scary too when you do it. It's used for whitening. Although if you really look at the peer-reviewed data, there's no science to support that it actually is effective. How it works is people will say that their teeth look whiter after, but all it does is really scrub the teeth really hard, like using a Brillo pad on your teeth. If you think about it that way, yeah, that would hurt, right? It increases sensitivity. So patients that will notice that their teeth actually are really sensitive to cold water, air, and things like that after using it. It's really not recommended, and it is really too abrasive for your teeth. So we urge that patients don't use charcoal-based toothpaste because of that. But the claim is that it makes your teeth whiter.
I can only imagine if you use that every day. The idea of taking a Brillo pad to like my mouth and teeth every day makes my mouth just like throb at that idea.
Yeah. So, patients who tend to have sensitive teeth that are sensitive to cold, like if you were to bite into a popsicle and your teeth are cold and that hurts, you don't want to be going with a extra whitening toothpaste or anything, because all that is more abrasive. And so you want to consider something that's a little gentler, something that maybe has an anti-sensitivity component in it, like a Sensodyne or Pronamel. I think Colgate and Crest have sensitive versions of their toothpaste as well. So you want to stick with something like that.
It's crazy how many options. Like, I ran out of toothpicks the other day and I'm standing in the aisle and it's literally an entire aisle of toothpaste and a little section of mouthwash. And then now there's a huge section of like whitening stuff, which we'll talk about all those trends later. But the idea is like, how do you choose a toothpaste that's right for you? How do you choose one for your kids? For you, or like if you're elderly, is there something new? Like my grandparents use a different kind of toothpaste than my Crest that I use.
Yeah, so that's a real
each age.
Yeah, I think it depends on the individual. I think that you need to have an open conversation with your dentist about what's the best toothpaste for me and my family. And it might not always be the same toothpaste for you, your spouse, or your children. Pretty much the one thing that does across the board, and every dentist will say, is just make sure there's fluoride in it. Some patients need dry mouth versions. Some patients need extra fluoride, which is a prescription toothpaste. Kids don't like mint, so you're not going to have your kid brush with your toothpaste if they don't like the flavor. So there's berry flavors or fruit punch or all these other things. So I can't really say like what's best and what's not, but I think that based on what your dentist knows about you, you can definitely have that open conversation with them. And don't necessarily just believe like the sample that they give you, because that's not always the case. A lot of my patients don't use the toothpaste that we give them because it's not the right one for them. They get a prescription or they have recommendations for other types of toothpaste.
Oh, that's interesting. Yeah, it's one of those things that now I swear we have so many choices about so many things that every time I go to the store, like I never know what to pick for anything.
Just call me, I'll tell you. I know your mouth enough.
I'll be texting you next time I'm in Target. So treating young patients, you were talking about the kids practice and stuff. I mean, I know there's difficulties. Kids, the first time they go to the dentist, I know you said there's some tears occasionally. Does that like lessen over time, or are there just some kids that no matter what you do, they start crying?
I mean, we work to lessen it over time. You can imagine that if you're bringing your child in at 1 year old, that's probably going to be pretty short-lived. If you're bringing your kid in for the first time at 5 years old and they've never been to a place, I mean, we'll work our best. But at that age, between kindergarten and first grade, typically, kids start talking to each other. And so your child might say, to his, Johnny might say to his little friend, I have a dentist appointment today. And then the kid will be like, friend will be like, oh my gosh, let me tell you about, and start scaring your child. I mean, kids talk. So some of the anxieties might not be coming from anything other than what your child's hearing from friends. And so if you can get them in before that is a possibility, it's not going to take very long to extinguish that fear. And we work very quickly. I had a little girl in yesterday, actually. It It was the first time I was seeing her for fillings. And apparently she was super nervous. I didn't know anything about it. She had seen my coworker before, and my other dentist was working with patients. And so we were both sitting in the office, and she goes, hey, you know, I didn't hear any crying. And this girl's 10. So she was, you know, still a little anxious. And I said, why? Oh, well, she was like freaking out at her cleaning and blah, blah. And I'm like, okay. But the funny thing is that if you take time with kids, and if you do exactly what you say and they match up, the kids will trust you. As soon as this happens and what you say and what you do is different, they don't trust you. And that's when the fear starts. So anyone who treats kids actively tries to make sure what they do and what they say are the same, and also try and baby step the kids. We're not doing 10 fillings at one time. We might do a sealant, for instance, and we start making sure building on really good positive experiences. So every kid's a little different. Some kids will always be fearful, but we give them the best care that they can, and we get it in the most comfortable way possible.
I love that kids are, I mean, just like adults, everyone has fears and anxieties, and that's so true. I can only imagine like what kids tell each other, because I remember all the things like riding home on the bus I don't even know what kids will tell each other about doctor's appointments anymore, especially these days when everyone has to wear masks places and all the doctor's offices. So everything must be like heightened anxiety to go to the doctor.
Yeah, I mean, more for the adults. I don't think COVID really affected the kids' perception of the dental office at all, but our adults have been more anxious. But, you know, we've been really fortunate through the whole COVID pandemic that there has not been any cases that have been linked back to transmission in any dental office in the country. And I believe maybe even internationally, there hasn't been any. Our standards have been super strict since the mid 80s with HIV. We changed a lot of our practices for infection control at that point, and those practices actually were sufficient enough for COVID. So that being said, the dentist office was probably the safest medical. I mean, I felt safer in my office than I did going to the supermarket, you know?
That's probably true.
Yeah.
We will be right back to talk about what kinds of foods are good for our teeth and some fun things. And after these messages from one of our sponsors.
Hi, I'm Liz Teresa. I help women launch and build online businesses they love.
I needed to give my brand a web presence, but I didn't speak tech. Enter Liz Teresa. With lightning speed, she got the essence of my brand. Her guidance notes, her tips were practical and concrete.
She's the #1 person in my life. I'm so happy she came to me.
So thank you, Liz Teresa. I am so excited to keep working with you.
And we are back with Dr. Andrea Fallon. She is a general dentist, and she's going to talk to us about some really fun things. We've been talking about all the things that are good for our teeth and getting our kids in early at the dentist, some things that we didn't even know. So we are going to be talking about the thing that I want to know. What is the best foods to help our teeth? Like for the kids as we grow, as adults to keep them strong. We don't want to get to be a senior citizen and our teeth are all decayed because we had the wrong kind of diet.
Yeah. So I think that it's not necessarily what you eat. Hear me out.
Okay.
We live in the United States. We're not getting away from sugar. Unfortunately, that's just not realistic 100% of the time. But we can be smart about those times in the day when we can actually enjoy those things. So it's actually a frequency versus quantity issue. So, for instance, what do you think would be better if I had, I'm trying to think here, how do I want to phrase this? If I had my bagel with cream cheese, my light and sweet coffee from Dunkin' Donuts, okay? I suck it down. I'm in the morning, 30 minutes tops, it's done. Or my little child who walks around with a cup with goldfish and is snacking on them all day? Which one do you think's worse for you? For your teeth, I should say.
I suppose like goldfish, like the crackers goldfish, or goldfish like those cookies?
Nope, just the crackers, the orange little crackers.
I would say the coffee would be worse for you because God knows how much sugar is in there, and there's sugar in milk and whatever creamer you use.
There is, but don't forget I said I drink it pretty quickly. So carbohydrates all break down into simple sugars: bread, milk, crackers. And if I'm taking a goldfish every 10 minutes and popping it in my mouth throughout the day, that's way worse than having a light and sweet coffee that I suck down in 20 minutes, half an hour. So it has to do with the pH levels in our mouth. So our teeth are mineral based, and it's a chemistry problem. So when we eat carbohydrates,
here we go.
right? When we eat carbohydrates, the acidity level in our mouth rises. And what that does is it causes those minerals in our teeth, fluoride, calcium, some other hydroxyapatite gets weaker. Okay. The hydroxyapatite is actually what the teeth are made of. Gets weaker because all of those minerals that keep it strong leach out of the tooth essentially. As the pH from our saliva, because our saliva is actually basic, so it buffers that acidity and brings it back down into more of a basic, then those minerals can actually be uptaken back into our teeth. The issue is that some of us, if we keep having the carbohydrate and our body starts to get the acidity level down and then it pops it back up, down, pops, you never get to that spot where your teeth can bring in those minerals again. And that's how we get cavities. Teeth get soft, and then the bacteria in our mouth colonizes them, and then that's what causes the cavity. So in actuality, frequency over quantity frequency is way worse. So
carbs are bad. Carbs can cause more problems than sugar?
Both. They're the same thing. When you break them down, they break down into fructose and glucose. And that's what the
But if we eat carbs for dinner, but not eating them like throughout the day, we're still okay though?
Yeah, so when we're actually physically eating a meal, you're finishing that meal within about half an hour, right? Something like that. Yeah. And we're chewing, we're creating saliva. Our body's producing a lot of that buffering saliva. So say you like soda, okay? I think, some of the sodas have a really bad rap for being bad on your teeth. But say it's something you really enjoy and you can't give it up. Well, have it with a meal. Don't just sit and sip it all day long while you're at your computer. That's going to be worse than just having it with your meal and enjoying it at that point. So we always really counsel our patients quite significantly on the effects of sugared liquids, sodas, coffees, juices, those kind of things, and also sweet foods, along with the carbohydrate snacks that we don't think are necessarily bad for our teeth, but are and can be.
That like completely changes my mind about something. Because like I talk about stuff with people like when they're trying to change their eating habits and about how carbs are actually sugar in our body. So eating a meal that's just carbs doesn't work for you. And going over those things, and I am always, less sugar in your diet is always my go-to, but that is just from a nutrition standpoint. I'm always trying to get people to eliminate less sugar. I know you're never going to completely get rid of it. It's just not realistic in people's worlds. But there are foods that I thought cheese, yogurt, water, I thought all that was better for your teeth, like leafy greens, all that stuff.
Yeah, definitely. Making good choices like water is going to be super helpful. I mean, the recommendation really is only drinking water in between meals. So yes, there are things that are good for you, but water has an acidity to it as well. Patients say, oh yeah, but I have LaCroix or these other like sparkling waters or carbonated waters. That's acidic. And so if you're say you had oranges all day long and that was your thing. Okay. Well, just, they're healthy. Someone said, they're healthy or whatever, but it's not just the sugar in the orange. It's the acid in the orange that also has an effect. So things that are good for your teeth, like anything that's going to help clean them while you eat. So thinking really rough foods like baby carrots, broccoli, things like that that are going to kind of like help actually brush your teeth without brushing your teeth could be very helpful.
So kale is definitely good for us no matter what we do, whether it's for our teeth or our insides or anything.
Yes, yes. And having a healthy diet in general, like Ashley, you and I talk about this all the time about inflammation in our bodies. Inflammation shows up in our mouth. So keeping your teeth healthy is going to help you be healthy, and keeping your mouth healthy, your gums, is going to help you stay healthy overall as well. So if you're battling blood sugar spikes and things like that, you know, having a healthy mouth and making sure you're seen regularly at your dentist can actually help stabilize those. So yeah, it's kind of one and the same.
That's interesting. Like, okay, so you're talking about pH in water and how that's different acidic. We had a guest on last season, Ashley Epperson, that owns Salacious Drinks, and she brings water from natural sources from all around the world. And the coolest thing about it that I love is that they show you the pH level, they show you the minerals that's in it, they show you like its natural electrolytes and things. And there is actually water sommeliers in the world, and they go by looking at it. And people that need certain things in their body, you can pick a water from all over the world. So yes, we can go and like literally pick how much pH we need. So maybe if we have problems with our teeth, we could pick what kind.
Yeah, I think that's so true. And you can go online and look it up too. There's definitely graphics showing about like different bottled waters and what their pH level is. Mm-hmm. And so you can pick, you want like the most basic one. And I think even my yoga studio has a special like Kangen water, I think it's called, and they put it through a special process. So it's actually at a basic pH. That's going to be better for your teeth. And, you know, there is some stuff happening research-wise that's showing that maybe having more of a basic pH level in your body in general is helpful.
Oh, I have to look at that. I've never really thought about pH levels. You know me and how much I love chemistry. Unless it has something to do with baking or cooking, I don't want anything to do with it. So eating like things like apples are a good thing for us in our mouth. I mean, they're good for us anyways. Almonds, seeds, all that stuff is rough enough like while we're eating to clean our mouths. Mm-hmm. Now, are there, other than the carbs and sugar, is there anything that's so bad for us to eat or drink that we really should not be doing it no matter what?
I mean, smoking, tobacco, those kind of things. The risk of oral cancer is on the rise. And maybe some of that is from COVID, people not getting seen as regularly. And so now we're seeing it, but oral cancer is really not easy to detect, and it's usually caught at a late stage. So definitely stay away from any carcinogens, smoking, dip, any of that stuff. Vaping is a huge problem. We're seeing it. My 10-year-old was telling me that she has kids in her 5th and 6th grade school that are vaping already. And and you know, with legalized cannabis use as well, I think that that's something that we definitely need to be aware of. Nothing is risk-free. And so I would say that would be something that I would say is an absolute no-no. The other thing is, you know, I find just for comfort, patients with very high alcohol content mouthwashes, their gums and tissues and everything get really irritated. So I would say use high alcohol mouthwashes in moderation. There's plenty on the market now which do a great job that don't have alcohol. So. Yeah,
I used one. I had a mouthwash for a while, but I stopped using it because I didn't like it. I literally felt like I drank or like used like alcohol-based mint in my mouth, and it just felt kind of too much.
Yeah, it can. And that's more of a comfort thing. I mean, it's not enough to hurt you. I don't think there's any studies on that, but it can increase the dryness in your mouth, which can increase your cavity risk. So we don't want to do that.
I know it makes you all minty fresh and everything, but it's like, I don't know, it almost smelled a little bit like alcohol-y. Like you can smell that. Like you know when there's certain medications or things, you get that like smell of like alcohol in it.
Yeah.
Yeah, that was not a good one. I've tried different ones. There's some natural ones now that are much better for you and have all kinds of things in them. How do you feel about the natural ones?
So there's not really any definitive studies that I'm aware of that even show that mouth rinsing is effective at all. I mean, it's not going to hurt you, right? If it makes you feel better, great. But unless it's a medicated one that you would get from your dentist for a certain problem you're having, probably not doing much. So if it makes you feel great and it's not irritating your tissues or drying your mouth out, I don't see a problem with it.
So we're going to talk about, there's a few things there's trends in home teeth whitening. And I've seen so many people get so obsessed because I literally stare at myself in a camera once a week, and it's like I can see everything wrong with my face, like when I stare in the camera. And people, because of Zoom and everything, they tried more home whitening, more face masks, more everything to make themselves look better. And there's whitening strips, there's these swabs, there's that tray thing that lights up. I don't even know what it's called. And we talked about the charcoal, and then something that I think is so disgusting, the coconut oil pulling thing. Like, I can't even talk about that because it makes my stomach turn. What about these? Are they effective? Are they things that are useful, or are they going to hurt us more than they're going to help?
So let's start with coconut pulling, because that's actually in a different category. It actually is for cavity prevention as people are using it. There are some studies to show that it can be somewhat effective to reduce cavities. But if you actually look at the protocol they used, you have to like pull the oil for like 40 minutes, twice a day. So for people who don't know what oil pulling is, it's basically putting coconut oil in your mouth and swishing it back and forth. So you're pulling it through your teeth. I know, right?
I can't.
there is some effect. If you're doing it right, like it's not going to harm you. But I can tell you, like 99% of the people doing it are pulling oil for 40 minutes twice a day. So I think you have to look at the protocols of what those studies showed. And they were in a very controlled environment that the people were doing it in with coaches. So you kind of have to take that into account as well. As far as the whitening trends, the bleach that they have in over-the-counter products is the same that you get at the dentist. It's the same formulations. There's only 2 formulations of it. So, but they're going to be lesser percentages, meaning that they're not going to be as strong. And the reason being is as you increase the strength of the bleach, the more likely you are to have damage to your gums temporarily, but like a chemical burn. It is uncomfortable, don't get me wrong, but it is something to be aware of. There are some companies that have that blue light that you put in your mouth that they say works and increases. But to be honest, the strength of the bleach that they're using, and they're saying it doubles the strength, it is such a low percentage that you can get some like boost up in brightening. But if you're a really dark shade, you are not getting, that pearl white color. You're just not going to get there with that product. And depending on the reason your teeth are stained, you might not ever get there. So although they're not going to hurt you, which is great, but they are expensive. I mean, you're looking anywhere from $20, $40 to like $60, $80, and it's not permanent, meaning that you have to do it every couple of months, like every 6 months or so, you're doing it again. So it might be beneficial to see your dentist, because any restorations you have, crowns, fillings, veneers, are not going to change color with the bleach. So if you have any of that and you try to bleach, those restorations are now going to look really dark. So really, it's best to talk with your provider to decide whether bleaching is right for you. And I am sure that your provider has an in-office or take-home that is professional grade that would work better if you are a candidate for it. So no, it's not going to hurt you, but it might not work.
So there are take-home versions that like you can get from your dentist to do.
And they usually involve like a custom tray fit. Yeah.
So that's a good thing. That's something that is an option than going into the office and having a thing. So what's the difference between doing these at home? I mean, obviously they're more temporary, but going in the office, it would be a more permanent or longer lasting treatment?
So usually dental offices will offer one of two or both bleaching options. So sometimes they have in-office whitening, which is usually done in one setting. So you're there for about an hour and a half and they bleach your teeth. And so you get an immediate like boost. These are you know, teenagers going to prom. Okay. Oh my gosh, my wedding is in a week. I need to get my teeth white. Yeah. So these are the patients, or the patients that just simply don't think they can follow through with 2 weeks of daily bleaching. Okay. The other option is to have custom trays fabricated for yourself and then have a professional grade bleach gel that gets put in those trays and then worn from anywhere from 10 minutes to half an hour, depending on the strength, once a day. Usually in about 2 weeks, you're boosted up to that color that your teeth will get to. And then you can maintain that over time. No matter what, you will rebound. You will relapse over time. Even myself, I have to touch up and bleach, a couple of days every 6 months. So you still have to touch up. It's never going to stay stable, unfortunately.
Well, I mean, it has to do with what we eat and we drink and coffee, red wine,
and your biology. Foods. And your biology. Some people have color shades of their teeth that don't bleach well. And so it's definitely, that's why I would hate for our listeners to try the over-the-counter bleaching and then get frustrated with it because they spent money on it. You really should talk with your dentist because your dentist will let you know, hey, you have a shade that I think could bleach out really well. Or, you have a shade, you can try it, but you're not going to get to that pearl white. We'll be able to tell you that ahead of time.
And medications sometimes affect these things, right?
Yep. The most common is tetracycline or any of those type of antibiotics if you're given them when you're a child. Tetracycline.
Right. Usually. Yeah.
So, and it's when we're children. So if you look at the development of our teeth, when we're infants and toddlers, our adult teeth are already forming. So any medications that are in our body at the time of our body forming that enamel layer will be affected. So that goes for medications we're given, high fevers. We can see fever lines on patients. It's almost like looking at, like a geologist looks at a side of a mountain with rocks and they can see like what year. That's kind of what happens. And we can see kind of when in development that disturbance was. So there's, our teeth are starting to form when we're very young. So it's not usually medication induced when we're adults and taking it. Like me taking tetracycline isn't going to affect the color of my teeth now.
Okay. That's interesting. Yeah. I mean, it sounds like a tree. Like you cut open the rings, you can see what happened each year. And
yep, it's exactly what it looks like. Yeah.
So is there anything, before you go, is there anything you'd like to share with our viewers about taking care of themselves, what they eat, what they drink, how to go to their provider? Obviously, we talked about the kids. Maybe we want to reiterate that point about the little ones.
Yeah. Let's, if you have children, if they have at least one tooth or are 1 or older, they need to be seen at the dentist. I think that the biggest drive home thing that I want to say is that dentists, we want you to have nice teeth. We want you to be healthy. So I don't know everyone's specific situations, but your dentist does. And so we need to see you in order to help you through that. And, I hope that this talk today kind of helps spur some questions for you to ask your provider, because I truly feel that dentistry, medicine in general, but dentistry in particular, because that's what I'm familiar with, needs to be a partnership between the patient and the dentist. And you should always know what's happening and why it's happening in your mouth. And then what are we going to do to fix it if it's something that's not right? Ask questions. Your dentist wants to answer those questions for you. We're very approachable people, I promise. We do love our patients, and we do know that the mouth is a small part of our body, but I can tell you it does affect a lot of things in our body, and we can sometimes see things in the mouth that are harbingers for potential issues down the road or conditions that maybe aren't diagnosed yet. So going to your dentist is super important. So pick up the phone and make a call to your dentist if you haven't been lately for x-rays and an exam and to get your teeth cleaned. And then have those conversations, please.
Did you guys all hear that? This is our yearly reminder to make that appointment that we should have probably been making way a long time ago, or that one where you get that card in the mail and you totally forget. So if you guys have got that card and it's posted on your refrigerator and you're like, I have to call tomorrow, this is your friendly reminder. Now you can just—
And thank you so much, Ashley, for having me on. Appreciate it.
Thank you for being on. Now, after these messages, we are going to work on a nice salad and update it for your Memorial Day. Andrea, thank you for being on. Have a good rest of your day. Bye.
Bye.
So we're going to update a nice classic salad that you guys can be bringing to your Memorial Day picnic, and it'll be a favorite of yours all spring and summer long. Right after these messages. Oh, and if I can find these messages. So for those of you that watch me all the time, you pretty much know that I constantly press the wrong button when I'm trying to switch over to the food. So I'm going to update a classic caprese salad with a green goddess dressing, but I'm not going to make it creamy. I'm going to make it with a vinaigrette. Now, I love a caprese salad. I love the traditional with the balsamic everything, but fresh herbs are starting to become in season. The farmers markets are outdoors now. Everything is blossoming. Now, tomatoes aren't quite in season depending on what part of the country you are. That's more of a late season thing. But I have these gorgeous ones from a nice hydroponic farm in the area, and we're going to cut them up. So these ones here are Campari tomatoes. Usually in the summer, I love getting the heirloom ones, and I love being able to make them into different colors. It's so much prettier, like a presentation-wise. If you do the different colors, it's so cool. So we're going to just cut these up. Now, the thing about tomatoes is they do need a good amount of salt, kind of like potatoes and tomatoes. See, it rhymes. So remember, if you're making anything with potatoes and tomatoes, we want a good generous amount of sprinkle of salt. Not so much that you can't eat it, but enough that we give taste. And like always, tomatoes and things, as the season changes, you'll need less or you'll need more, depending on the weather. Hopefully, we'll have a nice summer weather, and we won't have crops that are a little bit behind. Now, tomatoes are wonderful, but let's get to the herbs. Here, I have them washed, and I have them just sitting on a paper towel right here to dry out, because that's a wonderful way to do it. You can wash them, get them lovely, and then you just do it and dry them out, because we want to wash our herbs. We want to make sure they're clean. So I just have parsley here. Parsley stems are actually really great to add to stocks and things. I don't quite like them for the dressings. They're a little bit hard, but I use them for homemade stocks. So we have parsley. Parsley, I believe, was used to freshen breath. They said you can use that. You can use mint to freshen your breath. So herbs are actually a good thing for your mouth. Let's get that all in there. Nice bunch of parsley. So I got about 2 tablespoons of parsley. I have some chives here, or you can use green onion, whatever you like. I'm going to get out the one here that's a little bad. So I'm just going to cut the ends. You always want to trim the ends when it comes to chives. They're usually a little wilty or a little brown. As the weather gets in, we're going to be getting different things in season. I'm so excited. I change it up, the herbs that I put in this. A lot of times I'll add mint, sometimes tarragon. It all kind of depends on what's at your local market. Now I have dill, which I love. Reminds me of pickles, but it also reminds me of like a ranch dressing type thing. We're going to just do that. Perfect way to get it off with a knife. Now with dill, you just want to kind of get it in a nice little ball like this and just chop it up. Perfect. And remember, when you're chopping, keep the tip of the knife down on the board. Nice big chop. All right, In we go. Now we have about 2 tablespoons of olive oil. And I'm actually using a white balsamic vinaigrette. So it's got a crisper, cleaner flavor. It's not as sweet, so it's gonna wake up the tomatoes. I like it. It still tastes balsamic, but not too much. Now a pinch of pepper, as always. And a pinch of salt, because everything needs a little salt, a little pepper, because salt and pepper bring out flavor and everything. All right. And that's to taste, because you may like a little more salt or a little more pepper. All right, I'm going to make noise for a second. Don't panic, everybody. All right, talk amongst yourselves for a second. I know, isn't that lovely? Sorry. I wish I could not use that and make noise, but what can I say? All right, let's see if I can get this off. Aha. So as you can see, it's starting to get all mushed up and good in there. I'll scrape down the sides and we'll get it in. But we want to finish cutting up our tomatoes. So I also have some baby cherry tomatoes here that I'm going to add in. The different shapes and flavors, each tomato has a different kind of flavor. So let's put that in. This time you don't have to tune into Instagram afterwards. You'll be able to see the salad in real time. So I'm laying it out on the plate here. Let's move the board out of the way. Okay. So we're laying it out on the plate. The thing I like with mozzarella, I have nice, good, mozzarella. I like to pull it apart and just lay it in there. Because honestly, that is better and it's beautiful. Because cutting fresh mozzarella is so hard. I recommend if you want to cut it, put it in the freezer for a few minutes so it can firm up. So here we go. Okay, I got a taste test. I think it's good, right? There's so many local cheese purveyors in the area that I think that's enough. You have a pinch of pepper over the tomatoes and a pinch of salt. Remember to season before you put the dressing on. The reason that you do that is because they need to have seasoning before you put the dressing on. Now, this is going to be very herby and have a lot of flavor. And we can put maybe, I'd probably blend this up a little more if I wasn't going to show you a little bit of it today. But you want to drizzle it on. Here we go. Let's get a little bit of it out. And drizzle it throughout, and you're going to get this nice green herby thing with a hint of balsamic, but just more of a cleaner balsamic than sweetness. And this is the perfect update for your Memorial Day barbecues. Now, I hope you guys all had fun and you enjoyed talking to Dr. Fallon today. And that was your reminder to get your kids in early, to check that postcard you have sitting on the fridge. And here is our beautiful salad. I'm always backwards when I put them in the camera. And I will show you some more of that. I'll take pictures and put it on my Instagram page afterwards. So everyone have a lovely Memorial Day. Let's pray for the good weather, and I will see you soon.